Do y'all have any personal experience with a stroke? I know that I do, because both my grandfather, my grandmother, and my great-grandmother have died of a stroke. So I definitely have personal experiences with a stroke. So that is why I'm going to be talking about having a stroke. Before I talk about stroke, we're going to learn about the causes, the symptoms, treatment, and the prevention of a stroke. But what is a stroke? The stroke is a supply of brain that's either interrupted or reduced, which causes the blood vessels to burst, in the brain to burst. And then when that happens, the brain doesn't get enough oxygen nor nutrients when this happens. And then according to the Center of Disease Control and Prevention, which also the CDC, more than 750,000 have a stroke. 610,000 of these people have strokes are either their first ones or their new ones. And then strokes kill about 130,000 people per year. So the causes. It's causes by the hardening of the arteries. And then there's 3 types of strokes. It's a ischemic stroke, a hemorrhagic stroke, and a transient ischemic stroke. With the ischemic stroke, it's a blood clot that can travel through the body wherever. It starts in the brain and then it can go anywhere in your body. And then a hemorrhagic stroke is a weakened blood vessel that bursts. And then a transient ischemic stroke, which is also called a TIA, it's a blood flow is impaired in part of the brain. So the symptoms. Sometimes the biggest symptom is the numbness of the body, especially on one side of the body. Here we go. And then your vision changes a lot when you have symptoms of stroke. And then you have severe headache, dizziness, and confusions. And sometimes with the confusion, you have difficulty of speaking. But you may ask, how can you tell about these symptoms? Well, there's a test called FAST, which is called FAST, and it's an acronym. The F stands for face. As for smile, does one side drop? Arms. When raised, does one side drift down? S. Speech. Can you repeat a simple sentence or do you have trouble slurring your words? And if you can tell all of these symptoms, the last one is T. Call 911 if symptoms are present. So now that we have gone over the causes and the symptoms, what are the treatments of stroke? Treatments are surgery, which you can remove any plaque and arteries to prevent having another stroke. Speech therapy. When you have a stroke, you will lose some of your speech, basically your basic skills. So you go to speech therapy to repair or regain your basic skills. Physical therapy. Like I said earlier, the numbness of the body, especially on one side, will be weak. So if you want to help regain your strength and balance, you must go to physical therapy. And then join a support group. You can talk to somebody about having a stroke because having a stroke is a traumatic part of your life. And you just need somebody to talk to, vent to, and to cope with it. So, the preventions of a smoke, you can either reduce or just quit smoking at all. Limit your salt intake because salt increases your blood pressure. And I would know because I do have high blood pressure. So I'm trying to control my blood pressure. And then you can also take medication. You can maintain your weight and diet, and then exercise regularly. So today we went over what a stroke is, the causes, symptoms, treatments, and prevention of a stroke. Luke Vandross quoted, "I feel a sense of sadness and joy. Mostly sadness, though, about what I've experienced, and sadness about what others have experienced in reference to a stroke." Thank you.
All right. Thank you. Gosh, Hilton, that's got to be kind of scary.